Hi, I am Dr. Ashish Desai, consultant neurosurgeon at Aadicura Superspeciality Hospital. At Aadicura, we are a team of two full-time neurosurgeons and we manage all brain and spine related diseases here, like brain and spine trauma, brain and spine tumors, hydrocephalus, brain hemorrhage, spinal degenerative disease, etc. We are equipped with a state-of-the-art modular neurosurgery OT, which has an advanced Leica operating microscope, Medtronic high-speed drill system, a minimally invasive spine surgery set, apart from other routine equipments. We have a state-of-the-art ICU along with a full-time functional physiotherapy department. Today I shall talk in brief about brain hemorrhages. Brain hemorrhage basically means hemorrhage within the cranial cavity. It encompasses a wide variety of pathologies like extradural hemorrhage, subdural hemorrhage, subarachnoid hemorrhage, intraventricular hemorrhage, and the intraparenchymal hemorrhage. Talking about each of them, the extradural hemorrhage means the hemorrhage outside the dura but within the bony cavity. It is usually traumatic in origin. Subdural hemorrhage is hemorrhage beneath the dura but above the surface of the brain. It is again traumatic in origin. Subarachnoid hemorrhage is a hemorrhage within the subarachnoid space that harbors the CSF. It is usually as a result of aneurysm rupture or it may be as a result of trauma. Intraventricular hemorrhage is hemorrhage within the ventricles of the brain and it is as a result of hypertension or may be traumatic in origin. The intraparenchymal hemorrhage is a hemorrhage within the brain matter or within the substance of the brain. It is usually as a result of hypertension, trauma, tumor bleed, vascular malformation bleed, etc. Brain hemorrhage is usually present with a variety of symptoms ranging from mild headache to excruciating headache, nausea, vomiting, seizures, paralysis, or at times even loss of consciousness, respiratory compromise, and rarely sudden death. Detailed neurological examination is required to diagnose. Associated history of trauma, hypertension, headache may be helpful in clinching a diagnosis. The first line of investigation is usually the CT scan which shows the brain hemorrhage. Later on, other investigations like CT angiography, MRI brain with angiography or digital subtraction angiography may be needed. Patients with brain hemorrhage usually require ICU admission and the further treatment. Not all cases require surgery. Many of the patients do well with conservative management and with physiotherapy. In those cases where surgery is required, a craniotomy, that is opening of the skull bone, is required and evacuation of the hematoma is done. In certain cases where there is so much edema, the skull bone is not kept back immediately but is replaced after 2 to 3 months. This is called a decompressive craniotomy. And other cases like intraventricular hemorrhage with hydrocephalus may require an external ventricular drain placement. Cases with aneurysm require either a craniotomy with clipping of the aneurysm or coiling of the aneurysm via endovascular route. So this was in brief about the brain hemorrhage. I would urge all of you to take your hypertension medicines regularly, observe traffic rules, wear helmet, wear seat belt and be safe. Thank you.